Ayurveda classes, and today we'll be learning the main topic, that is the lungs that is in the fourth part in the respiratory system. I have uploaded larynx, pharynx and tracheas in my channel, and this will be the last part of the respiratory system, that is the lungs, which is important. They'll ask respiratory 10 marks. If they ask, you have to expand more and more about the lungs only. So for lungs in Sanskrit we call it as the Fufusa. What? Fufusa. For this Sharangadhara has given one more important shloka. For 10 marks if they ask, you have to write this shloka, which is very very important. That is Nabhista Pranavahan Sprushta Vahasta Kamalantaram Khantad Bahirviniryati Pantu Vishnu Padamrutam Pitvam Chadambara Puyishnam Punasyati Vegat Praniyanam Dehamakilyam Jiva Yajjatara Nalam. This is shloka. See, if I explain this shloka meaning, it takes more time to cover the lungs video. So I'll be explaining separate this shloka for 5 minutes in my another video. If you want to write, you can go and check that video. You can write this shloka if they ask for 10 marks. If not, just passing marks. If you write this content of English, that will be more enough for the exams. So we'll move on to the lungs, that is the Pufasa. Just first look at the diagram, what all you have to there. Lungs, this is the brachial tree, this is the trachea, and lungs will be made up of the two layers. First outer layer will be parietal layer, inner layer will be visceral layer. In between what space you can observe now, that is known as the pleural space. Next it has the three lobes. This is right lung and this is left lung. For right lung you have three lobes, upper lobe, middle lobe and lower lobe. For left lung you have only two lobes, upper lobe and lower lobe. And here you have the cardiac nodes. Cardiac nodes means when you draw the heart, no, heart left side will come and tilt like this, no, that is known as the cardiac nodes, where heart is tilted more towards the left, no, that is known as the cardiac nodes. This is the diagram must be drawn in the exam. So we'll move on to the concept. Lungs, that means Professor. Lungs are paired of respiratory organs situated in the thoracic cavity. How? Of course, in thoracic cavity only lungs are present. Right and left lungs are the separated by mediastinum. Means this is the area what you observe. No, this is known as the mediastinum. So right and left lungs are separated by the mediastinum region. Each lung is enclosed by the pleural cavity. That means two layers what is present, that is pleural cavity. General features: lungs are spongy in appearance. In young, the color of lung will be grey and becomes slightly black due to inhaled carbon particles. As we go on, our age increases, no, from grey it turns to black. So weight, right lung will be 700 gram, left lung will be 600 grams, 700 and 600 gram. Lungs are covered by serous membrane called as the pleura. It has two layers. The layer attached to lung will be the inner layer will be the visceral layer, and outer layer will be the somatic layer or the parietal layer. What it can also known as the parietal layer, and the in between these two spaces is filled with the pleural fluid. Next, external features. Each lung shape will be conical shape. Do not confuse. It is a conical shape. Dome shape will be the diaphragm. Conical shape will be the lung. Many of the students get confused that they'll say, whenever asked what is the shape of the lung, they'll say the diaphragm. No, it is a conical diaphragm. Diaphragm will be the dome shape. It consists of the apex or upper and base at the resting of the diaphragm. It has three borders, two surfaces. Means apex means upward. This is the apex, and base, that is resting on the diaphragm. This is the base that is resting on the diaphragm, that is known as the base, and it has three borders: anterior anterior, posterior and the inferior, and surfaces, two surfaces: costal surfaces and medial surfaces. Two surfaces: costal surfaces means this side, medial surfaces means this side, and three borders will be the anterior, posterior and the inferior border. These are the three borders. Base is the semilunar in concave. Semilunar in concave. Of course, it has to be concave. It has go like this. It rests on the diaphragm. Diaphragm separates right lung from the right lobe of the liver. See, right lung is this side, so liver will be this side. So in between the diaphragm is there. So diaphragm separate right lung from the right lobe of the liver and left lung from the left lobe of the liver, which is very easy to remember. Now borders. Anterior border is very thin and shorter than the posterior border. Anterior border of the left lung show the cavity below the fourth costal cartilage, that is cardiac knots, and posterior border is thick and ill-defined, extended from 7th cervical spine to the 10th thoracic spine. Inferior border separate base from the costal and medial surfaces. Inferior border separates the base from the costal and the medial surfaces. So this will be the inferior border, this will be the anterior border, and this will be the posterior border. So anterior border is well defined and it is not defined at the cardiac notch place. And the posterior border is the ill-defined. Inferior border is downward, which is near to the diaphragm. These three are the borders. Next, surfaces. Costal surfaces is surface large and convex. It lies along the side of the ribs. It is covered by costal pleura. Medial surface is divided into two parts, posterior and mediastinal pattern. You just remember two surfaces, that is costal surface. If you consider this as the lungs, now what you will see, this convex shape, now this is the costal surface, and inside what you will see, now that is the medial surface. This is the main important, very important MCQs they fixedly ask, because in our first year time, no, they ask this one as the MCQs, not this. This they ask for the MCQs. What is the difference? Which is the organ that is present in the right lung but not in the left lung? This will be the question. So by head this table important. If you want this information with content image, here it is there. See, one I will explain, that is E parietal and hypocritium branchial, which is present in the only right lung. So this will be the right lung. See, E parietal bronchia here present, hypoparietal bronchia is present. So here these two are present, which is absent in the left lung. This is left lung, this is right lung. These are the openings that are found in the, sorry I forgot to inform, these are the opening root of the lungs, that means openings that are found in the lungs. And here one pulmonary artery, here also one pulmonary artery, two pulmonary and two pulmonary. One bronchial artery will be present, here two bronchial artery present. Only these two differences that can be observed. So don't forget, study this table. Next will be the fissures of the lobe. As I said previous only, right lung is divided into three lobe. If you want to divide into three lobe, at least two fissures should be present. One will be oblique and another will be horizontal. That means, see, consider, I will draw and say. See, consider this as a right lung, and one should be horizontal fissure, another will be oblique fissure. This will be the oblique fissure. So horizontal fissure and oblique fissure will be found in the right lung, and left lung, sorry, this will be the left lung, and for left lung only two lobes and three lobes it means, upper lobe, middle lobe and the lower lobe. And the left lung will be having only two lobes, upper lobe and the lower lobe, and it has only one fissure, that is the oblique fissure. And just remember this much. Next will be the explanation of the bronchial tree. This one you know, that trachea is divided into right and left bronchial. Right bronchial leads to secondary lobar bronchia, tertiary bronchia, terminal bronchia. Bronchia turns to bronchioles, alveolar ducts, arteria, air circles, lungs. This they'll ask for the 5 marks. Explain bronchial tree. You can draw this diagram for that question. See, trachea, it divides into bronchus, next tertiary bronchus, terminal bronchus, respiratory bronchioles, alveolar duct and lungs of the alvea. Further they divide into the arteria, air sacules and lungs of the alveoli. Next will be the blood supply. Arterial blood supply the lungs receive from the two sets of the arteries. That means oxygenated blood comes for the nutrition in lung tissue for the bronchial arteries. From bronchial artery, oxygenated blood will go to the lung. Deoxygenated blood comes for the heart for pulmonary artery. Means deoxygenated blood will also be coming for the lungs. No. So this deoxygenated blood, that channel which carries to the lung will be the pulmonary artery. For what? For oxygen purpose. Another, for lung itself need oxygenated blood for functioning. No, that will be carried will be bronchial artery. Next will be the venous drainage. Again two bronchial veins, right bronchial veins and the left bronchial veins. This much if you remember, that is good. Don't just remember azygous vein, intercostal vein, that will be very complicated. So just write right bronchial vein, left bronchial vein. Next one will be the nerve supply, that is parasympathetic nerves will be from the vagus, same as the trachea. Parasympathetic stimulates the causes of the bronchospasm, narrowing the airways. Sympathetic nerves comes from the second and fifth spinal segment. Sympathetic helps cause a dilation, widening of the airways. If air comes now, it has to go widening, so that will be done by the sympathetic. Para means which is contraindication, so it has to close, so that is the parasympathetic of the lungs. So clinical notes of the lungs will be includes the first one will be tuberculosis, that due to Mycobacterium tuberculum infection. Next one, the COPD, chronic obstructive pulmonary disease. This includes the bronchitis. Something ITS means infection. So bronchitis, bronchiectasis, bronchial asthma, pulmonary tuberculosis. Among these, if you write any 2 to 3, that will be well enough. That will. Next, narrowing bronchial tree causes the dyspnea, that means breathless. You know this, write this. So this much will be video of the lung and respiratory system will be completed in this video only. In my next video, I will cover the remaining systems of the Rachana Sharira. And if you like my video, please like, share, subscribe to my channel. It takes more effort for me to create videos for you because I have very big hectic schedule that I'll attend my classes from the 9 to 5 and again I'll go for hospital from 6 to 8, and after that I need to come, I need to cook my food and I have to do videos for you. So if you like my videos, please like, share and subscribe and share to your friends. Let's grow together this channel. Thank you.